Of course, diffuse large B-cell lymphoma remains a challenging group of patients to treat because we know that many patients can be cured with R-CHOP chemotherapy, but those patients who aren't cured with frontline therapy actually do really poorly. So it's certainly important to try and identify the patients who are going to fail earlier so that we can consider alternate therapies. So one of the things that people are exploring is whether or not you can use an interim PET scan to identify who those early failures might be. So the clinical trial that we performed in British Columbia was looking at the use of interim PET scan in patients with DLBCL. Our basic trial design was that it was a phase 2 single-arm study, and all patients who would normally be eligible to receive 6 cycles of R-CHOP for diffuse large B-cell lymphoma, so generally advanced stage patients, could be enrolled and would start treatment with 4 cycles of standard dose R-CHOP, and after 4 cycles they underwent a PET scan. And if that PET scan was negative, they just completed with 2 more cycles of R-CHOP as per standard of care. But the patients who had a positive PET scan after 4 cycles were actually deviated to an alternate salvage regimen of R-ICE. So the idea was that we don't know whether or not at that point you can switch to something that might have non-cross-reactive benefit and still be able to get a better outcome. So we treated, well, about 150 patients were enrolled in the trial, and of those patients, about 60% of them had a negative PET scan, so went down the standard of care route of just completing treatment with R-CHOP. Remaining patients were either positive or had an indeterminate PET scan. In terms of the PET positive patients, there were approximately 50 of them. The majority of them were switched over to the alternate salvage regimen of R-ICE. I think what we found was that in a general population of DLBCL, so these were not necessarily transplant eligible patients, so some of them were actually fairly elderly, switching from R-CHOP to R-ICE mid-treatment based on the PET scan was actually quite difficult for some people. So about 20% of patients that switched weren't able to tolerate the R-ICE. And of those that did tolerate it and went on to complete treatment with 4 cycles of R-ICE, the majority of them still had a positive PET scan at the end of their treatment. So it was somewhat disappointing. We did find in the end that patients who had a negative PET scan did much better than patients who had a positive PET scan. So, it was prognostic of how they did, but I'm not so sure that we were able to influence the outcome of the PET positive patients. As I stated, the majority of them still had a positive PET scan after switching over to the alternate therapy.